Labiaplasty, vaginal tightening, hymenoplasty. What are these terms?
These topics are these procedures, I would say, are very rarely spoken openly, right? There's again a strong taboo because these are purely female oriented, relating to female private parts.
I heard a woman getting married. It was her first marriage, of course, and then the husband couldn't find a hymen during their first night, and he started accusing her of not being a virgin. So, what do you have to say about this hymen? Why men are very
Obsessed
with the hymen?
Okay, so hymen is a very flimsy or a thin structure just at the beginning of the vagina, and it has by default a small hole inside it so that when the girl starts menstruating, the menstrual fluid comes out.
So, doctor, what is labiaplasty?
So what happens, many cases these patients have a lot of discomfort when they're wearing pants or when they're sitting in a particular way. This rubs, causing friction, pain, some injury. It can also go for infection.
Labiaplasty, vaginal tightening, hymenoplasty. What are these terms? So I'm here with Dr. Pinky Devi Ayyappan at Nothing But Truth. I'm very curious to know what these terms refer to because these topics are very rarely spoken or discussed. So what's your take on this, doctor?
Definitely, Shweta. Now, these topics are these procedures, I would say, are very rarely spoken openly, right? There's again a strong taboo because these are purely female oriented, relating to female private parts, right? So it's not very comfortable to openly talk. But having said that, but is it really important to know? Yes, why we are talking when the such surgeries exist, some procedure exists. That means people are getting it done. But when we don't talk about it, right? When people are not knowing where to go, lot of mishap can happen, right? So in my practice, I've seen a lot of patients who want it, but they don't know whether it's possible also. So these topics have to be openly spoken about. There's nothing to shy away from it, right? And it is not a fancy thing, I would say. Many of these procedures, what we are doing is a necessity. But due to feeling shy, shame, a lot of people don't talk about it.
Okay. So doctor, what is labiaplasty?
So Shweta, labia means we have in a female private part, we'll say we have the labia majora, bigger, and labia minora. So in many women, this labia minora are also, we call it as an inner lip, is very big. It is hypertrophy. It's become much bigger than the normal size. So what happens, many cases, these patients have a lot of discomfort when they're wearing pants or when they're sitting in a particular way. This rubs, causing friction, pain, some injury. It can also go for infection. Now, when we are reducing this labia minora especially, we call the surgery as labiaplasty.
Okay.
So it is a surgery where we are reducing the inner lip or the labia. That is labiaplasty.
So for whom is this surgery? For young girls or older women? When does one really get to know that they have a problem with their labia?
So again, this is nothing to do with age. Some people right after the puberty or 18, 20 will start seeing that they have really big one. But initially, as I was saying, because they don't know whom to talk, then sometimes they feel they're wrong in even thinking about it. So if they try to tell their mother, they say, oh, why are you even, bother to look in that part? But they are undergoing lot of discomfort with it. And now, whatever said, the dressing has changed. People are wearing more tight-fitting dresses, right? So this can cause lot of discomfort.
Okay.
So it's not any age. I have done even for a 20-year-old. I have done even for a 30-year-old, 35, after marriage, before marriage. So it depends when the patient gets the awareness about it. And it is a very, very, I say, subjective surgery in the sense there's no definitive mark. I can't say if it is so big, you have to get it done. There's no measurement.
Okay.
It is basically if it is causing discomfort, to the patient, then it's better to go for labiaplasty.
Okay. So how is this exactly performed?
So labiaplasty, it's like a daycare. More so, I'll say it's a quick procedure. Can be comfortably done under local anesthesia. That means you don't need to give a major anesthesia. The part which we're operating, we're just giving anesthesia there. So there are different techniques we use. We use, it can be edge labiaplasty, we say, or the wedge labiaplasty. In both of this, we are measuring the labia, how much is needed. So typically we say 1 centimeter we leave behind and rest of it we cut it. We may do some hemostasis and suture this back with the observable suture material. That means the patient need not come back for suture removal.
But is there any complications after the surgery?
Complication, I would say some amount of infection chances because it's in private part area. So we tell, and in that area we cannot put a dressing. It's an open surgery. So we will tell the patient to keep it clean. Every time they pass urine, they have to put water. Every time they are going for their stool, then they have to clean that area. And antibiotic cream is advised. A course of antibiotic is given. But in spite of all this, there can be a minimal chance of infection.
Okay.
Second complication is when there is over reduction done. Sometimes either the surgeon or the patient may request the size is overly reduced to the extent that it's completely gone. But there is a trend called Barbie look. So there are some patients who ask for this look.
Oh.
That means the labia is completely removed.
Okay, but what is the function of this labia, doctor? What does
Labia
it
is a
exactly do?
protective. It just gives a protection in that area.
Okay.
Especially during intercourse. When that there is like a protection, like a cushion there. But some people, due to the professional work, they ask for a Barbie look, in which we remove it completely. I don't know if you have heard of it. It is a different thing.
Okay.
So other complication would be other than infection. Sometimes that's why I said overcutting. Sometimes less removal. The patient may feel still it's bulky.
Okay.
Need to be removed more. Very rarely that wound may not heal well there. It may take more time. There can be some skin loss, the necrosis we say. There can be some pigment change. The labia has two different color inside and outside.
Okay.
So it is a light pink inside and a darker color outside. So sometimes that light pink may come out.
Okay.
Or it may become dark. So these are the certain complication with labiaplasty.
Okay. And typically, what is the recovery time?
It's very quick. I would say just 5 to 7 days, not even that.
After that, they can do their regular chores,
thing.
gymming, exercise.
Only discomfort I would say is in labiaplasty, it is the swelling remains for 4 to 6 weeks.
Okay.
So even after the surgery, that area feels very swollen. Right? So that some discomfort will be there. So I typically tell my patient to avoid any tight dresses. So that, they don't feel the discomfort.
Right.
And then sexual intercourse needs to be avoided for 3 to 4 weeks.
Okay. So, doctor, what I understood from what you said is labiaplasty is a daycare procedure, very simple and very quick. Recovery takes not much time, and it also eases the discomfort in women because of the labia. Okay.
Yes.
Doctor, I've also been hearing about vaginal tightening and loosening. So, what is it exactly?
So what happens, Shweta, in a lot of women, either due to multiple childbirth or with aging, or some people just have something called the vagina becomes very loose, right? So in these cases, many patients come to me, women come to me saying they don't get the pleasure. During intercourse, they're not feeling the sexual pleasure. They feel very loose. So in such cases, we can do something called vaginal tightening. Now, vaginal tightening, we can do either surgically, where we operate, or we can do through laser. There is a laser machine which we can helps in tightening of vagina. Now, with lasers, the early stages of loosening, which is just beginning, can be really treated well. But if it is due to multiple pregnancy, and during vaginal delivery, a lot of times the doctor has to put a cut there. I don't know if you have heard.
Yes,
it's called episode.
Yes.
So because of that also the vagina can become loose. Right? So in such cases, we do something called surgical vaginal tightening. Wherein we go, it is done under anesthesia. So we use spinal anesthesia. daycare surgery. So you do it in the morning, by evening you can go. In this, typically the posterior wall of the vagina, we are removing the excess laxity, whatever is loose. We are removing that, cutting it and resuturing it, right? And even we do there's something called perineoplasty. That means the outer part.
Correct.
Between your vagina and the rectus. Anus. There also the thing can become loose.
Right.
Perineal loose.
Yes.
That also we tighten it.
So you just suture that area.
Yeah, we cut that. Whatever. See, whenever there's something loose in the body, we need to cut it. Cut the extra and then suture it. So this is called vaginal tightening.
So why is it done?
As I was saying, it is typically done for because the
childbirth can be one of the reason. And do you think without childbirth also one will have a vaginal
loosening? Definitely. That's why I was saying it can be due to just aging.
Okay.
Over the years, it can happen, right? In such cases, when the vagina is very loose, we can do something called surgical vaginal tightening.
So when they get the vaginal tightening done, do they face any complications?
Yes. So complication in vaginal tightening can be few. One, when the vagina, the way it is located, it is very close to very other important organs in our body. Like in front of the vagina, we have the bladder, which collects the urine, as you know. Behind the vagina, we have the rectum, through which the stools are coming, right? So when we are dissecting the plane, so suppose this is a vaginal wall, your rectum is here. We are making a plane, we're lifting the vagina mucosa. So if you're not very cautious, if you're not careful, or if there has been before some surgeries done already there, or the patient had some radiation, something, we may injure the rectum.
Okay.
And a connection may form between the rectum and the vagina, like a fistula, right? So it's called rectovaginal fistula. So it's a major complication. Because your feces is coming forward. So these are a few and then the tightening can be too much of tightening, or it can be less tightening. But all this complication, I feel, can be avoided with an experienced surgeon. Because the anatomy is little difficult there. It's not like every surgeon can operate.
Correct.
So the operating surgeon should be well trained in it, should know what is being done. So other than that, some rare minor complication like some infection, bleeding, due to bleeding, some hematoma, the blood may collect there. So those are the other complications.
Okay. Doctor, you just spoke to me about the laser vaginal tightening.
Right.
So what is this laser vaginal tightening? I'm hearing it for the first time.
Right, okay. But this is a very, very hit, I would say, because anybody, especially women, are scared of surgery. Right? They don't want to undergo a knife. As long as they can manage without surgery, they're happy. Good to go. So in laser, we are using laser rays, waves at a particular wavelength, and hitting in the vaginal wall. So this vaginal wall will shrink. Like laser, you must have heard for your face.
Skin tightening, we use laser, right?
Exactly same.
Okay.
So we need at least 4 to 6 sittings.
Okay.
In a gap of 4 to 6 weeks. It's not one time. Personally, it's not a very favorite procedure for me, I feel, because the kind of women coming to us are with major sagging. They don't come in very early phase. Right? So surgical would be better in those cases.
Okay. Doctor, can you tell me about the recovery for both laser vaginal plasty and surgical vaginoplasty?
Sure. So surgical vaginoplasty, the recovery is pretty straightforward, quick. You may have some pain for 2-3 days, discomfort, I would say. You need to avoid any exercising for 2-3 weeks. But mainly, all patients need to strictly avoid intercourse, at least for 6 weeks. That is the strict criteria. Otherwise, what will happen? The wound will not heal and it will go for a wound opening. Then again, it becomes a headache for the patient. So that is a recovery for surgical. Laser vaginoplasty, again, is a very quick recovery. You hardly feel any pain. So maybe we advise the patient not to go for intercourse at least for a week time.
Okay.
That is a recovery for laser.
So what is the time duration that you need for each laser therapy?
Sitting, right?
Yeah,
at least 4 to 6 weeks.
Okay.
Between each sitting.
But no anesthesia, nothing is
Nothing.
It's not painful?
It's not painful.
Okay. Thank you, doctor. So, doctor, I heard a woman getting married. I mean, it was her first marriage, of course, and then the husband couldn't find a hymen during their first night, and he started, accusing her of not being a virgin. So, what do you have to say about this hymen? Why men are very
So very obsessed
obsessed with the hymen?
Okay, so hymen is I don't know if how many people know, hymen is a very flimsy or a thin structure just at the beginning of the vagina, right? And it has by default a small hole inside it so that when the girl starts menstruating, the menstrual fluid comes out. So this is a hymen. So hymen is like a thin film with a small hole. Now, unfortunately, in the world, not only in India, everywhere, this has been taken as a sign of virginity. You know, if your hymen is intact, you're virgin. I think it's the most stupid thing. Yeah, anyway, but so what happens is this hymen can break due to any reason. I'm telling you, it's a very thin structure as it is. It's not like a very strong something. So, some sports activity, cycling, wrong fall, when the children are playing, even that can break a hymen. So it's not necessary for the girl to have an intercourse to break a hymen. But you'll be surprised, there are a lot of casts, even today in India also, where this first night bleed, is very important to say the girl was virgin. So apparently I've seen in some movies.
Yes, white
shoes,
yeah, white clothes, white sari.
Yeah, so it is a lame thing. It can break even without an intercourse. So there's no need for us to say if hymen is intact, it's a virgin. But the society pressure is so much. These girls do come to me for something called hymenoplasty. That means we can repair it.
Okay.
Right? So in hymenoplasty, we do under local anesthesia. It takes around 15 to 20 minutes for the procedure. We are suturing back. So what happens?
So the hymen is still there in every
Hymen is, yes, when the hymen is broken, it doesn't mean it disappears.
Okay.
We have in the surrounding the hymen tags. The opening, which was just a small opening, has become big.
Okay.
Right? That's why if the hymen has broken, what they like to say, when they have intercourse for the first time, you'll not see any bleeding because the hole has become already bigger. But in a tight, when the hymen is not broken, when they have the first intercourse, that will cause rupture of the hymen and hence the bleeding.
Right.
So since the pressure from the society is so high, a lot of girls we are doing hymenoplasty. Right? So in hymenoplasty, I told you, the hymenal tags are there. We are repairing it back.
Okay.
Basically causing the hymen to intact.
Correct.
So this is hymenoplasty.
How is it done, doctor? Local anesthesia, like
Right.
you said, it's a
Right.
daycare procedure again.
Very simple, 15-20 minutes.
But do still people come here for that
100%.
in your clinic? Do you see
Yes.
women who come?
Lot of.
So what do you have to tell them when they think that hymen is the most important thing?
So that's what I tell them. See, one more thing about hymen is, lot of people don't understand is, even with intact hymen, first night you may not still bleed. Right? So even similarly after the hymenoplasty, on a first night you may not bleed. There's no guarantee of intact hymen bleeding. Right? So there's no way. But I think it gives kind of a secure feeling to the girl.
To the girl, not to the girl, maybe to the guy and their family.
Okay,
But do you still suggest it?
It's not. I'm not promoting hymenoplasty because it's a wrong thought process. Because you're trying to say if your hymen is intact, you're virgin. But there's no way to know whether the guy is virgin or not. Right? So this is not something which I promote, but it's something which I do if the patient comes to me.
Okay.
Right? Because I feel they need that help.
So is there any complications?
Very rarely. If it's done properly in a good hands,
No.
You don't see any as such complication.
And no recovery.
Because
Right.
nothing. Immediately you go back to work.
No
everything.
pain, nothing.
No. It's a very, very straightforward surgery.
So these were the terms that, I mean, not many people talk about it, or many people know about it.
Yes.
So I think this would have really been very important to know. For every woman should know these terms,
Correct,
actually.
correct.
And people wouldn't even know why they're feeling that discomfort, because they have to get a labioplasty done.
Correct.
And again, when you see the tightening and loosening, some women, when they grow old,
Yeah, they're just
so
leaving
much
it, yeah.
discomfort.
Yes, yes.
Yeah, so I think there's so many procedures that we women don't know. So I think these videos are they're nothing but truth. So you get a lot of insights from these, and you'll get to know a lot of terms and things that it's not spoken about and still a taboo. So if you guys want to know anything regarding plastic surgery or anything in particular, leave a comment below and we will address it. Thank you so much, Doctor, for this wonderful insight. So we will meet soon with another
Definitely.
interesting episode.
Yes.
So stay tuned.